You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network. To the MaternalRx podcast, where we challenge the status quo in pregnancy care and highlight how pharmacists can play a pivotal role in improving outcomes and help reverse the trajectory of preventable maternal morbidity and mortality. I'm your host, Dr. Danielle Plummer, pharmacist and antepartum doula. Today, we're addressing a part of pregnancy care that rarely makes it into routine counseling, but should: oral health. We counsel on folic acid, antiemetics, and avoiding teratogens. But do we counsel on protecting enamel from repeated gastric exposure? Pregnancy can heighten gum inflammation and bleeding. And with persistent vomiting, repeated acid exposure can silently weaken enamel. Yet many women postpone dental care, believing it's unsafe, or are told that bleeding gums are simply part of pregnancy due to hormonal changes. In my work with women experiencing hyperemesis gravidarum, I've witnessed the devastating consequences of that gap in awareness: significant enamel loss, advanced decay, and in severe cases, tooth loss. For most, it's completely unexpected. And in many cases, it may have been preventable with earlier counseling and collaborative care. So, what role should pharmacists play in that prevention? Today, I'm joined by Dr. Michael Duboff, who earned his dental degree, known as a DMD, from Boston University Dental School in 2000, has 25 years of clinical practice in dentistry, with 5 years in Boston and 20 in Las Vegas, and is an associate clinical instructor at the University of Nevada, Las Vegas, known as UNLV. Dr. Duboff will help us unpack what's happening in the mouth during pregnancy, what's normal, what isn't, and how pharmacists can better support patients through collaborative care. Welcome, Dr. Duboff. Thank you so much for joining us today.
Thank you for having me. That was some introduction.
Unfortunately, it's the truth. Women reach out to me from around the world after having very difficult pregnancies with extreme vomiting, and the toll on their mouth it's horrendous. And as I've done with so many things throughout my career as a pharmacist, said, why are we not talking about this? So I am so grateful for you to be here today and take time out of your busy schedule to answer some questions and help us learn what's normal, what's not, and what can pharmacists do and what can patients do to prevent this tooth decay and other hormonal changes that affect oral care in the mouth through their pregnancies. If it's okay, I would like to start with my expertise, unfortunately from personal experience, hyperemesis and acid exposure. So what happens to the teeth when they're repeatedly exposed to gastric acid? And at what point does damage become irreversible?
So what's going on in the mouth is a constant demineralization, remineralization of your enamel from your saliva. Saliva is your best friend. So with the gastric acid, it's going to eat away at the outer layer, which is the enamel. So you want to do things to reestablish the remineralization as soon as possible. Oh, you asked when does it get to the point where the damage is too far?
Absolutely.
So if you lose the enamel of the tooth, then your dentin is exposed, which is much more susceptible to wear and decay. Your teeth should feel smooth. So if it's starting to feel gritty or rough, you might have done damage to the enamel.
Thank you for sharing that. It gives a very clear picture of what's going on with the teeth and when it gets to the point that's too far. As pharmacists, we have a lot of pathophysiology, but dentin is not a word I'm familiar with. Where does dentin fall into this picture?
So basically, there's 3 layers to the tooth. When it's forming, it starts with the pulp, which is the nerve and the blood vessels inside. Then it forms with the shape of the tooth, which is the dentin, which is hard but not fully protected. And then the outer layer, which is the hard shell, is the enamel.
And that's the word that we hear about most, right? Protecting that enamel. So I love that. It gives a nice visual, and we can picture what's happening with our teeth when that acid comes in repeatedly. And at what point then have we gone too far and we can't reverse that? For patients with severe nausea, is brushing immediately after vomiting helpful? Because that's the intuitive thing, right? We vomit, we want to get that taste out of our mouth, protect our teeth. What sequence of oral care actually should be recommended?
That's actually the worst thing you could do. Do not brush immediately after vomiting. You want to rinse out with water, get the taste out, get the acid out. Give about 30 minutes to help remineralization, and then you can brush. Because if you brush right away, you have the weakened teeth, and then you're scrubbing away your enamel.
Such a frightening thing. And I think that's what
Yes.
happens with so many of these women just to get that taste out of their mouth.
Yes. It's very
Yes.
common, and yeah, you do not want to brush directly after one. Rinse your water is your best bet.
And I've heard baking soda and a water mix. Is that something you'd recommend, or is that not necessary?
Absolutely, that would neutralize the acid, allow the remineralization process.
Is that something you can make at home? I know they do sell baking soda toothpaste. Would you recommend that?
You can definitely make it at home. It's very simple: baking soda and water. Most people can't stand that taste, so the store-bought products have some flavor to it.
If a patient can't tolerate brushing because it triggers nausea, what alternatives might help protect that enamel?
Now, is it the brushing itself, or the taste of the toothpaste, or the foaminess? What is causing the?
Any and all of the above. We could break that down.
You could actually brush with just a wet toothbrush and not use any toothpaste. If it's a specific area of the mouth, I mean, you won't be doing the best job, but you could avoid that area. If you can't brush at all, I would say go to your rinses, flossing, and maybe more often getting a dental cleaning. I actually recommend every 3 months for pregnancy.
You recommend every 3 months. I've never heard anyone say that. And in fact, we see the opposite happen. Women, while they're pregnant,
Yes.
avoid going when really they should be going more often. I hope that message gets across.
Dental treatment during pregnancy is very safe. Recommend especially, the preventative, the cleaning. Some work can be put off till right after. That's fine. But you definitely want to take care of the gingivitis and any kind of infection that could be going on.
And that's extremely important as well, because what I've learned through my pharmacy training and working with cardiologists and in the hospital, that dental care ties in so directly to our heart. There's bacteria, infections that we can get in our mouth that if they're not taken care of, it can lead to other infections systemic throughout the body. Very scary. What are you seeing if women delay care and then come into your office? What type of things are you finding that could potentially have been prevented?
Well, pregnant women are susceptible to what's called pregnancy gingivitis. So oral care is very important.
Pregnancy gingivitis. Again, a phrase not commonly talked about. Can we break that down a little bit more as well? What is gingivitis?
So that is gum inflammation, bleeding gums,
And what causes that?
bacteria. It's your body, trying to fight the bacteria. You get inflammation.
What is the evidence on fluoride varnish and high fluoride products during pregnancy? Are they safe and effective?
Yes, I can't say enough good things about fluoride. I believe it's very safe, especially topically. You're just going to have it in your mouth and spit it out. Fluoride in drinking water is a different conversation because that's systemic.
I am so glad you brought that up. I grew up in New Jersey where we had fluoride in our water. I have the strongest teeth of anybody I know. And when you Google that, boy, it would terrify anybody from ever touching fluoride at all. It's at trace elements. It's been proven safe through our water system. That varnish that they just brush onto your teeth, it then gets rinsed off and it's going to protect that enamel layer. Is that correct?
Correct.
We can save systemic fluoride in the water for another conversation.
Yeah.
But
I know it's a big debate, and some people are anti-fluoride, and that's your option or preference, but just know that's your best defense against decay.
For patients whose enamel appears more porous or vulnerable after nausea, are there long-term strategies, preventative, that can be implemented?
Again, I'm going to go with the fluoride. Rinse your mouth, then get some high fluoride, possibly prescription toothpaste. You want to be hydrated. Oral rinses, excellent.
I think that's the biggest problem, especially when we talk about women with hyperemesis, hydration. Can you
Yes.
explain, right? We're constantly dehydrated. It's quite torture because we're thirsty. We drink water, but it doesn't stay down. There's so many changes in the mouth during pregnancy due to those hormones and the fluctuations. Anything from this dry mouth all the way to excess saliva, which has many different names. Ptyalism, am I saying that correctly?
Yes. Very
Okay.
good.
Pytalism, I
I
think.
think you got it.
Okay. That excess saliva alone, it could trigger vomiting. I actually once wrote a whole blog on things that might help. And there's a lot of dental tools that might help. You have these pads that you could put in your mouth to soak. You have a lot of women that will just be spitting to get it out. So you're not constantly.
Unfortunately, you're going to be doing a lot of spitting. It's just part of the
Yeah.
deal.
And what's not talked about, happens to a lot of women, it actually affects their social life because if you're out, if you're at work with friends, with loved ones, you don't want to constantly be spitting. But unfortunately, it is probably the best option. There's really not much. You don't want to keep swallowing that. Is that correct?
I mean, you could swallow it. There's nothing wrong with it. It's just
Okay.
saliva. Have you ever tried clonidine to help with salivary flow?
I love that you brought this up because this is a pharmacy podcast, right? Clonidine has also been recommended in past clinical studies for hyperemesis gravidarum. I had not heard it brought up for this case. There are other medications that are used in the OR for patients with surgery that might have a benefit, and clonidine is not one of them. Let's look into that and see if it would
Okay.
help. From what I've seen, most of the excess saliva
Yeah.
that women are producing during their pregnancy, it does not last the whole 9 months. It seems to taper off by mid-pregnancy. Is that what you've noticed as well?
Yes. They say second trimester usually gets better.
So even if you are on that clonidine earlier on, pay attention to your blood pressure. But
Yes.
Dr. Duboff, as you said, it's a low dose. And I'm gonna start investigating this one because boy, would that be a lifesaver. So I'm going to flip topics. If a woman knows she wants to become pregnant and is doing what she can to prepare her body, any thoughts on what can be done? We talked about getting in to see your dentist, getting a regular checkup if you are due for one. Are there any other recommendations while a woman's preparing to become pregnant?
Well, I would advise regular dental visits anyway. But if you are trying to become pregnant and you have been neglecting your mouth, I'd say that is the time to get in and get that taken. There's some studies about low birth weight, preterm pregnancies with gingivitis, periodontitis.
Can you talk about those studies? What's the evidence that's linking periodontal disease and those adverse outcomes like preterm birth?
Just like we spoke before, how the bacteria gets into the bloodstream, can attack the heart. Just imagine what it would do to the developing fetus.
Try not to imagine that. Yeah, no, it's quite scary. Honestly, it's something no one ever spoke to me about. All my discussions on pregnancy, no one's ever brought this up. It shows how important it is to get that dental care, preventative if possible. If treatment's needed, get in to see your dentist, get that taken care of before becoming pregnant. If you do become pregnant, it's okay. It is safe to go see your dentist and get procedures done, right?
We've treated millions of pregnant women. It's very safe.
I love it when we can put numbers to this, stop the hearsay, the things on TikTok, and see your dentist, get that care done. And if there is more extensive work that's necessary, have that conversation to say, can we do this now? Should we do this now? Or is this something that can wait until postpartum?
Absolutely. Yes.
There's still hesitation around dental x-rays. Is there a rule as far as what's considered safe or the timing? Anything we should know in those regards?
As far as I'm concerned, Dell X-ray is 100% safe. It's a low dose and you're shielded. So I'd say it's zero effect on the fetus. Best time for dental treatment is usually in the second trimester. Usually we will ask for a medical release from the OBGYN. Although we know dental treatment's safe, we know how much anesthetic to give. We do like to coordinate with the OBGYN.
Music to my ears, right? Collaborative
Yes.
teamwork. And I think for so many years, practitioners have practiced in silos. Pregnancy is not a time in life where you can be in a silo. Even though the experts are your obstetricians, this pregnant woman has so many other conditions going on. And we just touched upon how important dental care is during this time to prevent things like preterm births. And hearing that you can work with your OBs, you can work with your pharmacists and all the other healthcare providers that are out there, that's what's going to lead to best outcomes for that mom. Let's talk about postpartum. Do dental issues often emerge postpartum that may have started during pregnancy? And if so, how should they be addressed?
Yes. I mean, if you do have HG, obviously you've had that acid attack going on. So you want to keep up with your dental hygiene visits. Also, the pregnancy gingivitis that we talked about, you'd want to come in post-pregnancy, make sure all that has been resolved.
Very important to get that message across. And women, do keep in mind that you're going to have a newborn with you. So if you're going to see your dentist postpartum, or if you're debating, should I do something during this pregnancy or wait till after the baby's born, keep that in mind as well, just strictly for logistics. I would bring my little one and go, can they be here? Can they be in this, room while I'm in the chair? Or I just hope that they would be sleeping through that procedure. But, if they need diaper changes, if they're nursing or bottle feeding, timing to get anything done when you have a newborn may always be
Yeah.
complicated. Keep that in mind as
Moms
well.
have brought babies. We can work around that, hopefully.
I love that. If enamel erosion or periodontal damage has already occurred, what are restorative options that are effective to help improve that decay?
Well, luckily, gum disease is pretty much reversible unless it's gone so far where the tooth is loose. Luckily, you can get that under control. If you have had enamel damage where the tooth needs treatment, we could do composite bonding, or tooth might need a crown to cover it.
And I know financial stress can add to dental care. Is there any advice you have on working with insurances to get things covered? Like, I know most insurances cover preventative dental cleanings twice a year. Is that correct? I guess you'd have to work with your insurance to add a dental plan if you know you're going to need care. Any advice on that? I know it varies by state. It's a very broad question, but if you can add any tidbits that might help these women, it would be greatly appreciated.
Some dental plans are actually catching up with the times and allowing more cleanings, more preventative, while pregnant. And I don't know about other states, but Nevada Medicaid, pregnant women get full coverage.
What exactly does that mean, full coverage? For the cleanings or for
So
treatment?
normally adults don't get any coverage for dental under Medicaid.
Oh my
But pregnant
goodness.
women get pretty much 100%. So you can get all your treatment done while you're pregnant.
This is huge. I know this is a podcast. People are listening. You can't see my face when you just said that. My jaw dropped. There's normally not dental care on Medicaid, but while you are pregnant, you have 100% care. This is powerful. So for those
Yes.
women that are afraid to get dental work done while they're pregnant, these are things to keep in mind. prevent potential problems like preterm births, long-term problems like infections in your teeth, that gingivitis that can become systemic if it's not taken care of. This is your opportunity. Think about what's best for baby. Let's think about what's best for mom too. And for those pharmacists that are seeing these women at the counter, it is so easy for you just to say, hey, if you haven't thought about a dental cleaning, go ahead and talk to your dentist. Get that done now. It's more important than you realize. If somebody wanted to learn more from you or reach out to you, what's the best way to connect?
My email is good. SmileDesignersLV@Yahoo.
I'm so grateful you joined us today. Thank you for listening to the Maternal RX podcast. Again, I'm Danielle Plummer, advocating for better maternal outcomes through pharmacist-led collaboration. And being my first interview with a dentist, I cannot thank you enough. Thank you, everybody.